Hello, my name is Jackie Guffey, and today I'm going to be discussing inpatient falls in adult acute care settings, the influence of patients' mental status, a study conducted by Huey Ming Zhang. A fall is defined by Zhang as a sudden, unintentional downward movement of the body to the ground or another surface. Falls can result in serious injuries and even death. Falls are recorded as the #1 category of reported incidents in hospitals in the United States. As nurses, we should try and implement evidence-based interventions to reduce the number of falls and fall-related injuries. Falls are a common cause of morbidity and mortality in older people with dementia and cognitive impairments in community-dwelling settings. Falls and risk for falls for cognitively impaired older individual population depend on the severity and the type of dementia they have. A mental status deficit is referred to as a changed mental status or confusion or dementia. Older adults with any of these conditions may be admitted to an acute care setting to be treated for a fall or fall-related injury. Three researchers have argued about the most popular risk factor for falls in older adults. Hendricks, the creator of the Hendricks 2 fall risk model, claims that confusion is the #1 risk factor for falls. Another researcher, Valsallo, describes that confusion and history of falls are the greatest risk factors. And the third researcher, Krauss, thinks that altered mental status is not a factor in falls at all. Literature reviews are not consistent in identifying measures to prevent falls in hospital settings and are not current within the past 5 years. Zhang explores the prevalence of falls in which the faller's mental status deficit is documented as the main issue and related to the fall, and whether it is associated with the cause and the severity of the fall. Falls can either have intrinsic or extrinsic factors applicable to the patient. Intrinsic factors are those essential to the patient, such as age, history of falls, vision problems, unsteady gait, mental status deficits, or chronic illness. And extrinsic factors include elements that are external to the faller, such as environment or other hazards like tripping over clutter in their house. Zhang found that 45.2% of falls in acute care settings were related to toileting, such as moving from the better chair to the bathroom. Falls can have serious consequences, so preventing them becomes pertinent. The research problem in this study is to determine if mental status deficits are an intrinsic risk factor for falls. This study's aim is to determine if the faller's mental status deficit was a prevailing issue related to the fall. The falls were documented by RNs in an inpatient acute care setting. The second aim of the study was to look at the associations between the presence of the faller's mental status deficit at the time of the fall, the cause for the fall, and the severity of the injury. This study was an investigative study with a retrospective research design. It was conducted in 6 adult inpatient acute care units in a community, nonprofit, suburban hospital in Michigan. The sample was all fall incidents that occurred in those 6 adult acute care units during July 1st, 2005 and April 30th, 2009. To collect the data, the researchers used the hospital's electronic incident reporting system. The patient's identity was erased before the researchers received the data. The RNs had to choose from 23 options on the incident reporting system to identify what the central issue was related to the fall. This study was approved by the Institutional Review Board of the hospital before it began. Content analysis were performed on all of the fall incident reports. Zhang developed themes of the falls, such as activities the patient was doing and location of the fall. These themes were then entered into the database as a single variable. The severity of the fall was defined by the electronic incident reporting system, 1 being no apparent injury and then 4 being a major injury. The researcher used frequency tables to recognize the common themes of the fall between the fallers with a mental status deficit at the time of the fall and those without a mental status deficit at the time of the fall. The researchers also used a Pearson chi-square test to evaluate the correlation between mental status deficits and the seriousness of the fall. A total of 1,017 falls were reported during that time in the incident reporting system. And of the 1,017 falls, mental status deficits were the main issue in 346 cases, which is 34%. And the other 66 had other issues other than mental status deficits. The faller with a mental status deficit fell getting in and out of bed 45% of the time, followed by moving from the bed or chair to the toilet. 70% of the patients who fell during this time period had no apparent injury and there was no deaths. The researchers also evaluated the faller's age and the shift that the faller fell on. They did this because adults over the age of 85 with a mental status deficit have a higher incidence of developing sunset syndrome. The average age of the fallers was 72, and the average age of the faller with a mental status deficit was 75. The most falls occurred during the 7 to 1900 shift, but fallers with a mental status deficit fell more frequently during 2300 to 7 o'clock. The nursing implications for the study. Based on the findings in this study, we know that fallers with a mental status deficit are more at risk for severe injury compared to those without, and they fall more frequently than without. Nurses must implement implications to prevent falls in cognitively impaired individuals. Nurses can help identify risk factors for falls in patients that demonstrate signs of having a mental status deficit. A way to prevent falls as a nurse in individuals that are cognitively impaired is to engage nursing assistants and family members of the client in evaluating the mental status of the patient. Another focus for nurses should be to implement a fall risk assessment to further focus preventative care for these patients. One useful prevention policy for cognitively impaired fall risk patients is observation, especially during night shift when most falls happen for these individuals. Preventing falls in any situation was always the #1 priority for nurses and can help keep their patients safe. Limitations. A limitation discovered by the researchers is that the electronic incident system for falls only reported whether the patient had a mental status deficit or not when they fell, when it could have been more beneficial if it stated if they had dementia or confusion. Also, the RN's perception of the status of a patient could have been interpreted incorrectly. There is no sufficient mental status testing done on these patients when recording the fall. In conclusion, the findings in this study add to the healthcare field is that a significant number of falls occurred in the patients with mental status deficits. Fallers with a mental status deficit suffered worse injuries than those without, and fallers with a mental status deficit had less toileting associated falls than those without. Zhang concludes from the study that risk assessment for falls and targeted monitoring should be implemented in hospitals for cognitively impaired individuals for fall prevention. He encourages that studies build off this one to further establish evidence-based research for practice. Thank you for your time.